going to say a few words about androgenetic alopecia, which is male pattern hair loss, the most common cause of hair loss in men. This is caused by androgen receptors, which we find on the hair follicles, which we inherit. And then the male hormone dihydrotestosterone has an affinity for these androgen receptors, binds with them, and causes a process called miniaturization, which makes the follicles get smaller over a period of time. And eventually the hair follicles get so small that they disappear. So dihydrotestosterone, or DHT, comes from the male hormone testosterone, and it is converted to dihydrotestosterone by an enzyme, 5-alpha reductase. Now, the androgenetic alopecia process affects the hair shafts, and so it makes the hair shaft thinner and it makes the hair shorter, and this is called miniaturization. And over time the hair shaft loses its caliber, so it gets smaller and smaller and smaller in the miniaturization process, and it is mediated by the genetic code. And the genetic code is why we exist basically in this world, so that's a big thing. And you cannot take on the androgenetic alopecia process by just doing a small series of medications or treatments. It's a lifelong process if you want to take on the genetic code, and therefore that's an important concept to understand. One more thing is there is a little muscle attached to the erector pili. It's called the erector pili muscle, to the hair follicle, and in this muscle, through its blood supply, we get that the stem cells arrive that create the follicle and the hair shaft. So in the miniaturization process, at some point, the erector pili muscle disappears, and that is the point of no return for the follicle, and the follicle has then disappeared. But there are various ways that we can remedy that situation, and we'll talk about that a bit later.